want to talk to you today about the benefits of what we do in our office now, but you can find in other places, is the benefits of what you've probably heard as IV nutrition or intravenous nutrition in the arm. The reason why that we promote and currently do this in our office is because the more sick people that we see, the better way to get them well quicker is not necessarily pounding people full of pills they have to swallow, but trying to find unique ways to get them overly well from the inside out. And I wanted to show you a quick few visuals. Hopefully this will help you. So your intestinal tract, this is blown up, but has cells that look like this. And food comes in here and you have to digest it through this way. So if this is damaged, if these cells are damaged, you're not going to absorb well at all. And this goes for nutrients that we use like supplementation, pills that you would swallow. And so people who have issues and maybe chronic problems like Crohn's or bowel disease or even chronic stress over time, getting nutrients through the mouth to get through the intestinal tract can be a little more difficult. So what we do and what we talk about a lot is, and this isn't for everybody, mind you, but there is huge benefit for, I'd say, most everybody. If this is your intestinal tract, pretend this is blood vessels inside your body. So now instead of trying to get nutrients to come through your intestinal tract to be absorbed, we're kind of being sneaky about it and getting nutrients actually into in your bloodstream. So they come along down here and your body absorbs them and can help rejuvenate healthy cells from the inside out. So now we're not reliant on absorption, we're relying on basically a harder or stronger dose that allows your body to use things from the inside out. Think of like a construction site, and you have maybe lots of construction workers at the site, but they don't have any tools yet or any supplies. Well, how are they going to get anything done? So the best way for us is to give your body the ability to have the tools to improve from the inside out. And you see this with a lot of chronic disease. They're nutritionally depleted. A lot of medicines cause nutrition depletions. So this has caused a lot of dysfunction in the body where they're going to need more and more nutrition. And taking things maybe more supplementally through the mouth, let's be honest, can be daunting, can be a lot when you're taking 10 bottles of things a day. And this is why I think nutrition and supplementation gets a bad rap. It's not a necessary problem in the nutrition or the supplements, it's more the body is just not in a state that it can absorb and use correctly. So let me get my eraser here. We promote that from kind of healing the inside out. So when people are involved in a functional medicine program, we're using extra tools to help people get well as best that we can. Now this can go for people that are in a good state and trying to prevent disease. For instance, I get IV nutrition probably once a week to help me, let's say before I'm traveling or before maybe cold and flu season and stuff like that, to really boost my system, to provide my body better tools and a better way to thwart illness and disease. The other way we describe nutrition intravenously is like this. So pretend this is a cell of the body, and all of your nutrients need to get in this cell to work for DNA, genetics, to make new healthy cells, to replicate, to heal. When your cells break down and shed, they need to heal, intestinal tract being a big one. So we try to give the body nutrients, again, the ability to heal and to repair, basically. What nutrition through the blood, or IV nutrition or infusion, what we call, does is you're basically saturating the system with enough nutrients that allows the cells to then absorb nutrients passively. Or actually, the concentration gradient is making nutrients actually move through the cell at a faster pace. Versus maybe if we take things supplementally over the counter or just orally, that concentration is not very high, so it's not going to get into the cell like we want it to. So we can take things all day and probably doing some good. It's just going to be very, very slow. An analogy I give people is saying if you're taking supplementation orally, which is good, again, it's like saying you're in a rowboat and you're still going straight. It may take a while, but you're going. And getting a good set of nutrients through the arm or intravenously is more like a big push of wind that kind of pushes you from behind and moves you a lot faster. So you're still rowing, but you're now going a lot quicker. And then you may slow down again, then we got to push you again. So I know me personally, but as trying to help as many people as possible, our hope is to give as many tools for people to heal the best that they can. So I am not about recommending bottles and bottles of pills to people. The more you take does not mean the better it is. We got to look at the vessel, ourselves, and how healthy can we be and at a state can we be to allow ourselves to heal from the inside out, to promote healthy internal environment, to therefore thwart chronic disease and illness. So nutrients, so there may be questions about what nutrients do you use to help people, and this is things you've already heard of. Vitamin C. Interestingly, vitamin C, when you take through the mouth, you can only take a certain amount because then the bowels or the gut can't absorb anymore, so people get loose stools. So you can only get so much, but through the arm you can do a lot more, which again goes back to the saturating the cells of the body, especially during, let's say, times of stress. You can do things like B vitamins and vitamin B12, antioxidants. Those are things that prevent your body from basically aging too fast. Another good one that I like is called glutathione. Glutathione is your body's chief antioxidant. He's the one in charge that can help your body from aging the quickest. He helps your liver, he can help your brain, protect your heart, but it's hard to get glutathione supplementally. So a lot of good strategies are in place to give glutathione intravenously to really support people at a whole new level that other people aren't. So I wanted to give that quick background on why we recommend and talk about intravenous nutrition therapy. We love it here. We encourage people to come and relax, and it's very safe, and it's very supportive to people to get optimally well. So thanks for your time.